Golf to Go is brought to you by the Hagen Oaks Golf Super Shop. Here's Frank LaRosa.
You know, there's so much emphasis these days on looking good and feeling good, and probably something we should have done a long time ago, but recognizing what it is about ourselves individually that we could improve on. I suppose that's the first step, isn't it, Greg?
Yes, we try and get every golfer that we work with to try and figure out what their deficits are specifically. Sometimes the yoga program that your wife's doing is not ideal for you, or vice versa.
Yeah, so obviously we have to have a desire to get something done, but we are a society that wants instant gratification, and this probably isn't something that has instant gratification, but how do you set up for a program like that to keep somebody interested in moving along?
Yeah, that is the toughest thing. In the physical therapy side of what we do, we've got patients that have heart disease that need to exercise, otherwise they may not make it, and they have a hard time exercising. So fortunately, one of the things that we try and sell is that we did a research study it's probably about 10 years ago, and we had about 25 or 30 golfers there were some professional golfers and some really high indexes. And we told them, you're going to give us 40 minutes of your time, 2 times a week for 8 weeks, and we're just going to measure some basic golf stuff. And after that amount of time, we got about 13 yards increase in their driver and about 8 yards in their 5-iron. So you tell a golfer you're going to hit it 13 yards farther, that helps.
Yeah, I mean, that's language they can understand. So what does it take first? A desire, an ability to know what you need, or where does someone start and how do they find you?
They often get sent to us through their golf pro. Among the other things that the obvious things about getting stronger and so forth, and then being able to hit the ball farther or something like that. There's also the factor that if you're not able to keep the club on plane, if you're not making the swing that you want, it might be due because of something physical. And if you can address that physical part of it, if we've got a golf pro who tells their client, look, you can't take a full turn, you need to go see somebody and see if we can figure this out, that might motivate them to kind of be able to have a more consistent exercise program. And
there's probably lots of us out there that in many ways ought to be able to self-diagnose. We should know that our backs hurt when we play golf and maybe just come to you directly.
Absolutely. Yeah, and we see a lot of that too. What we try and do whenever I'm out speaking to the public, I usually tell them to do a few kind of easy tests to see if there's some deficits they might have. Things like stand on one leg, and if you can't stand on one leg, then you may want to just practice that and work on your balance a little bit. And we do the same kind of thing for their mobility and can you do a full squat, and can you march in place, and that kind of thing. Simple stuff.
All right. So how are we going to find you if we need you?
I'm at Perry Physical Therapy and Athletic Enhancement. We're at the corner of 34th and Folsom in Midtown Sacramento.
So he's going to teach you how to eat better, how to feel better, how to be stronger, and how to hit the ball 13 yards farther. There's no downside.